Good morning. Welcome to Nursing Scholars Day. My name is Jill Daniel. I'm one of the research cohort members this year. Thanks for joining Creating a Winning Abstract. Today, I have Dr. Mikaela Olsen, clinical nurse specialist, and Dr. Brenda Shelton from the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins Hospital. Mikaela, what are some key elements of the Johns Hopkins Hospital publication presentation review and approval protocol to consider before beginning this process?
Hi, I think it's really important to know that there is a policy that must be adhered to when you're getting ready to think about publications or presentations. And this policy is in our HPO manual. It's ENR 302. It helps to figure out what the approval process should be when you're getting ready to present. It defines the nurse role, the author and authorship roles and accountability. It talks about scholarly work that you submit as an employee of Johns Hopkins, because you are using the Hopkins brand. And so it's very important that the quality of work is at a high level, and that you have full approval from your director of nursing and the nursing research group. Royalties, if you receive royalties for the work that you do, this must be told to your employer, and there may be negotiations that need to occur with the legal department. Ownership of the work has to be discussed, and all of this is outlined in the policy. Your responsibilities are to make sure that you are working on a conservative timeline that does not put a lot of pressure on your leadership. So you need to know what the work is that you're looking at that you would like to publish, know the timelines and deadlines for the conference, and make sure that you're being respectful of everyone's time and submitting drafts and the work early on so that you can get approval and give everybody enough time to read through everything and agree to it. Of course, hopefully after you hear this lecture, you'll understand the importance of defining your abstract topic early and doing the work in advance so that you're not doing things last minute. You are using that Hopkins name on your scholarly work, and this does require approval from the Director of Practice, Education, and Research. So you want to make sure you're working far in advance.
I'd also like to add that even if you're doing a project as a student and you think that you're under your student domain, that if the work is done here, the project is done with the staff here, it still needs to have our logo and has to go through the same approval process.
Thank you very much. That was very, very helpful. How would I choose a topic or idea for submission?
Well, the really good thing I think now is that we have the arts program. And so through the arts program, you may be doing a project or have an idea, and you have to work on that from the beginning of the year and create the project in full. And as you do that, you may come up with an idea through one of your arts projects. You may have an evidence-based practice question that you've always wanted to answer or thought about. And so there are lots of different ways. There could be a patient that you took care of that you had something happen with, or it was an unusual situation, a case study, or an unusual diagnosis. It may be a unit-based project that you're involved in or that you lead. So there are lots of ideas. I know Brenda has lots of students that she helps with through this process, and both of us are constantly thinking of things that we could use as an abstract idea or a topic. Remember that we're at a large teaching institution, so although it may seem commonplace to you, it may be a topic that is fairly new and innovative that somebody in a smaller hospital or in a community environment may really benefit from.
That sounds wonderful. Mikaela, what are some examples of abstracts that have been accepted?
So a couple examples. I mean, I've submitted, Brenda and I both have submitted, probably, I wouldn't be surprised if together we have over 100 abstracts submitted in publications. And I think that a couple of my favorite ones, of course, my doctoral project using saline to flush central line catheters was a really exciting evidence-based practice project I did that turned into a publication and a podium presentation. And I think that we've done a lot of work here in the Cancer Center around delirium and have written some abstracts around the management of delirium in oncology patients that really helped inform and educate other cancer centers on that topic of delirium and how important it is to screen patients for delirium when they're hospitalized.
I think you always remember your first too. And mine was a group project where we were looking at oncology critical care, and the staff and I submitted an abstract on the special needs of cancer patients in critical care and for the Critical Care Association. But I think the most memorable probably for me was I submitted a abstract on management of a pericardial drain one year, and it was rejected, and I got feedback that it wasn't timely. And I was thinking, but there's absolutely nothing in the literature on this, and there was nothing to guide us, and we didn't know what the heck we were doing. We created this based on best science, and you rejected it? But then I submitted the next year, and the feedback was, what a timely topic. This is perfect. So I think you have to remember that if you are competing with a lot of other people doing the same thing at the same time, you need something to stand out. If you're ahead of the curve, you may want to resubmit next year.
Right, that's a good point. I'm thinking about the idea of CLABSI. Lots of people are submitting topics on central line associated bloodstream infection prevention, but if you have something sellable in your approach to CLABSI prevention and something unique, that you're more likely that your abstract among the 10 others submitted for the same topic would get pulled and chosen.
Thank you for sharing. How do I choose a conference to submit to? And what are the important considerations when reviewing the submission criteria and directions?
Well, I'm going to have Brenda help me with this one as well, but I think that you should not only look at your specialty conferences, but you should look at other conferences. So for instance, I am a clinical nurse specialist, and I belong to the National Association of Clinical Nurse Specialists, and they pick up a lot of varying topics. And so choose conferences that you will like to attend and that may be part of your subspecialty, but also think outside the box and look at other things like Sigma Theta Tau, or if you're doing a research project, a research conference, something that you believe that will pick up your idea and you will be able to disseminate the information through that conference. So that's the first question. Brenda, do you have anything to add to that?
I actually think it's really important that you consider who your people are that really want the information you have to share, and choose a conference based on how you're going to get the information you want to share the most widespread. But it's also really important to understand that certain conferences have rules about having presented something before. And if you're going to submit to one conference where you can never have presented it before, then that's going to be your one and only, or you're going to present to others later. If you submit to a conference that doesn't have any rules, then that may block you from presenting at a bigger conference that you want your word to get out. So you do want to do a little bit of thinking about that. And I always advise students specifically that you put a lot of work into a project. You want to make sure that the audience that is going to benefit from your information is going to be hearing it.
Right. And some conferences, you really need to look at the criteria for submission. Some conferences do take case studies, others don't. Some conferences or some abstract submissions have to have pre and post data. And that's not going to happen in 3 weeks. So these are projects that you've been working on for quite some time. And so that when you write the abstract, you actually have some data to include in the abstract to talk about what your project is about and what you have found, at least some preliminary information. You may not have finished the entire project, but you need to be able to lay the foundation in that abstract for what your project is presenting. So really take a look at the websites for the different submissions. There's usually different buckets, which we'll get to in a minute, but it's really important that you make sure that this is a good fit for you. And so I think a lot of homework has to go into that piece of it. And then obviously you're not going to submit the abstract until it's been approved by the Hopkins, through the Hopkins process. And at that point, you need to be able to present to your director of nursing and your manager and whoever you're working with, this is my abstract and this is my plan for submitting it. This is where I'd like to submit it to, and these are the criteria. Okay, so Jill, I think we were going to talk next about abstract criteria. Is that right?
Yes. What are some common abstract categories and criteria?
So this is just a list of some of them that we see commonly. So an administration or leadership bucket, program development or management, education, case studies, clinical practice, evidence-based practice. There's sometimes topics on creative solutions or innovations, and then of course research. It's important that you know which of these categories you might want to submit to. And I think Brenda taught me this a while back, that maybe you have a really amazing abstract, but you're worried that it's going to be too commonplace in one of these, like the clinical practice category. So maybe you put a leadership spin on that topic, or an educational spin on the topic, and submit it into a different category to get accepted. Do you remember talking to me about that idea, Brenda?
Yeah, I think that's an important piece to consider. A lot of conferences have added quality improvement and patient safety categories, but I think sometimes that it's the process, not necessarily the outcome, that is what other people will want to model and take away. So you may want to put it into one of the categories that is going to have less competition, shall we say.
Right. And less competition, but also maybe highlighting important parts of your project. I think about my saline flush protocol and how my first publication is going to be more about the fact that it worked and that it eliminated heparin, but then I could have multiple publications. I could have one just talking about the education for this and how I rolled out the education. I could have one on the theory behind the whole project. So you can possibly submit to different conferences and use different strategies for your publication.
What are the key steps in developing an abstract?
I think that one's Brenda's.
So first thing you want to think about is to have an idea. Like you want to formulate a few sentence description and decide what your takeaway message is, because a lot of times we write abstracts and we just go on and on and on. The takeaway message, and what is it the person that comes and stands in front of you and listens or looks at your poster takes away, is what is the winning part of the abstract. So then bounce it off your colleagues. Get as many opinions as you can. Look at the scientific and the professional basis of it. Be careful as you are writing it to avoid abbreviations and jargon. Remember that not everybody lives with the same jargon as you do. Every place you're going to submit will have different abstract sections. Homework that in advance so that you know that you've got the content in the right little areas, because you usually have to load it into the abstract sections. A lot of times they are similar because of the way UC publications have the same sections, but not always. I actually like to save the title to last because I sometimes will make a title that says what it is instead of catching somebody. And I want to catch people. I want to draw them in. And so sometimes I don't know until I'm done writing it what that title should be. I just have a working title. But keep in mind, most have word limits. Many have author limits. And I average 11 to 15 drafts on an abstract. So
Wow.
that's something to think about.
Yeah.
Yeah.
Don't be frustrated by that, and remember that your first draft is probably going to be way too long, way too wordy. But if you start the first abstract draft, like Brenda said, with the right sections, you'll be much less frustrated. If you just start to write the abstract and then try to plug it into the sections, that can be pretty frustrating. So don't be frustrated. You want lots of feedback, and it's really helped me to learn how to write more succinctly and to take out extra words that are not necessary. When you're trying to get an abstract down to 300 words and you've got 6 words to take out, it's very tricky, but challenging and fun at the same time, and it helps you learn.
My word, we're almost out of time. We better move along.
What are some of the must-haves in a good abstract, Brenda?
Well, I have to say that I've sat on several different committees that have selected abstracts, and I would say that you want to make sure that the subject matter validates the category. There's nothing worse than reviewing something that actually doesn't fit into the category. Make sure that you examine the sponsoring organization's priorities. Some are conference priorities, some are education or research priorities, and then somehow make your abstract fit in with that if you possibly can. Constantly think about, how can this be generalized to anybody? Can this be taken to the rural area? Can it be taken to ambulatory when it's an inpatient? And think about your message of making this generalizable and usable by others, because that is going to be the readers who are reviewing and approving acceptance. Grammar and spelling, absolutely a must, and it has to have value for the participant. I can't tell you the number that we threw out when we couldn't understand what they were trying to say. We saw a lot of errors in grammar or spelling, and we thought, well, if that's what's in the abstract, what's going to be in the presentation? So I think these are really good take-home bullet points. This is also, I say this is also just going to be in your slides, and I'll let you take a look at some judging criteria. These are not uniform everywhere you go, but what you will see is that most of them have different kinds of questions for the reviewers. And if you keep these in mind and you think about it and have your friends read it with these questions in mind, you may actually find that you will keep changing and modifying it. So we'll leave these in the slides, but we won't talk about them right now.
Okay. We can move along to, I guess, our final and last question, just in the essence of time. Most abstracts are now entered online. How do I ensure successful and timely submission?
Oops, sorry. Well, I think that I touched on this a little bit earlier. You definitely don't want to go to a website late and then find out you've got to submit an abstract next week and you really wanted to do it because you don't have time to get that through the approval process. So you would maybe need to say, okay, I'm going to look at this conference site now, and then at the next time I'm going to submit, because that's just too short of a time period. But if you've worked ahead and you have everything done and approved, and you've got it all in a Word document, and you've already studied the website, you know what the categories are, you wrote your abstract in that manner, and now you're ready to cut and paste it. You want to make sure you're in a location where you have good internet access, that you take your Word document and you copy. Remember, you've already done your word count in your Word document. You need to make sure, does the website include titles in the word count or not? And then you need to make sure every single section you're going to submit is the proper word count. I have heard of people that have submitted abstracts that had 10 more words than they should, and they were rejected. So your word count must be precise. And then when you go into that website to cut and paste everything in, you need to be very careful as you're doing that so you don't cut something old or cut something that had too many words. And then double check it as you put it in each section before you hit the submit button. Some websites will allow you to submit as a draft and then come back in and resubmit. Just make sure that you get a final submission notice before the deadline and that you have some kind of an email confirmation, because I've also heard of people that submitted it and didn't realize it was in a draft and never hit the final submit button before the deadline. So deadlines are important. How you paste it into the website and into each section is really important, in having the proper word count. And Brenda, I don't know if you want to add anything to that.
Well, I think these days there's also attestations from all your authors. And so you want to make sure that all your authors know where you're submitting, know what the timeline is, and that they have a very limited amount of time to attest and validate. A lot of times I find myself at the last minute not realizing somebody's gotten a new certification, and I have to put in them as authors with their full credentials. So it's helpful to, again, think ahead. Do you need a CV or a resume to attach to it? Because sometimes you do and sometimes you don't. So these online methods don't always show up in your instructions exactly. And you almost have to go in and pretend you're starting in order to understand all of the obligations that you have.
Right. Yeah, that's a really good point. And the process of authorship is an important one. You definitely want to make sure that you are not putting in an abstract as the sole author when you had a team of people that worked on that project with you that should be part of that publication. And so that should all be something you do way in advance sometimes the conferences actually want you to be a member of the society to submit the abstract. So that may be an important point too. They want to make sure that sometimes the co-authors have to be members, sometimes they don't. So just making sure you know that prior to submission is important.
Okay, well, I think we have covered all of our slides. Do either of you have anything else to add today?
Have fun with it. That's all I would add. Enjoy the process.
Yeah, start way early, and remember, we have so much amazing talent here and so many amazing unit-based projects and so many complex patients with complex treatments and scenarios. There's just a wealth of stuff out there that could be published that needs to be presented and published outside of our organization. So hopefully you will be excited after listening to this presentation. There's also so many mentors around here that are good at publishing and doing this kind of thing. And there's lots of help. So get help and try it. It's so fun. And you'll get the bug like Brenda and I and many others, and you will just want to keep doing this.
Mm-hmm. Thanks, Jill.
Thank you, Jill.
Thank you.